Good evening. I am Dr. Purnima, consultant gynecologist from E-Road ARC Center. Today we are going to talk about ICSI procedure. So ICSI and IVF are a different procedure. Today among the public they have lot of miscommunication about the procedures. They think they need to have lot of bed rest and the procedure is stressful and that is a difficult procedure, and also financially it will require a difficult position, but it is not so. ICSI and IVF are a bit very simple procedures and I'll explain it to you in detail today. So who are all the suitable persons, couples who will require that ICSI procedure? And also for the male partner, if they have as count is very low and their motility and the morphology is low, so these are all the couples who will be eligible for ICSI procedure. So ICSI is nothing but intracytoplasmic sperm injection. So for this procedure, first we will select a couple. So first we will analyze what are all the problems they have been facing. We will evaluate a complete hormonal evaluation for both the male partner and the female partner. So male partner will have a semen test, they will have sperm count, the motility and the morphology, and for the female partner we evaluate sugar, thyroid, blood counts, serology, and we see the uterus, and also we evaluate their ovaries with the antral follicular count that shows the ovarian reserve what they have. So some people even at the age of 35 they will have a good ovarian reserve, but for some female they will have the ovarian reserve as low. So for them ICSI procedure will be very suitable, and even if the male partner has low semen count, ICSI procedure will be a very good option for them. So and also one more important thing we give to the couple is the psychological counseling. So in case if the couple is very disturbed and emotionally let down, we give a good counseling and we take them to their comfort zone and we explain everything in detail to them. So when the couple is in our comfort zone, definitely the stress will be reduced and almost all the stress hormones will be less and they will have a very good output. On the second day we have a basal scan evaluated. We look up the uterus and also the ovary, how many follicles, antral follicular count, how many are there, and then we tell the couple. So these are all the ovarian response you have, so the number of follicles you have. So from day 2 they will have their hormonal injections according, and we screen them for every 4 days. We have a hormonal blood test. From day 8 we have a daily scans and we see the adequate follicular growth and then give the hormone injections accordingly. So that is done under a mild sedation for the patient. Small anesthesia is given and the female partner is sedated and we prepare her for ovum pickup. So after the ovum pickup is done, we see how many follicles we have retrieved, and among that how many follicles have gone to the second stage. So once we get the details, we get the sperms from the husband and the sperm is injected intracytoplasmically and our embryologist will do the procedure of ICSI. So after once the cytoplasm sperm injection is done, so our embryologist will let us know how many embryos we have got on day 1. So once if the embryo has become a blastocyst and it has grown till day 5, so that is the time embryo will have a good quality, and if we transfer that embryo, the success rate for the ICSI procedure will be good. So for those couples we advise them to go for a frozen transfer. So what is frozen transfer? So after the ovum pickup is done, after the embryo is ready, we freeze them, and after 3 months of endometrium is prepared, so the 3rd month the frozen transfer is done. So when the couple is ready for frozen transfer, again the embryologist take out the embryos, they thaw the embryos and it is handed over to us to for embryo transfer. After 15 days we will get the results. Thank you.